Okay. Good morning, Miss Jackson. My name is Daniel, and I will be the nurse working with you today. How are you feeling today?
I'm doing okay.
Okay, so we got a lot to go over in a short period of time. We have about 30 minutes, and I'm just going to give you an idea of what our plan is today. So, since we've never worked together, we'll just kind of get to know each other. I'll do a physical exam, and then the physician will come visit you. And then the three of us will formulate a plan to determine how to get you feeling better. How does that sound?
Okay.
Okay, since we've never worked together, would you mind telling me a little bit about yourself?
Well, I'm 72 years old. I'm married with 2 kids and 1 grandchild.
Oh wow, that must keep you pretty busy.
Yeah, I guess. Not as busy as I used to be.
And what would you mean by that?
Well, I used to be an executive for a big computer company, but they made me retire about 10 years ago due to my poor health. I gave those people 23 years of my life, worked my way up, and then they forced me out. What can I say?
I'm so sorry to hear about that. You must have been really good at your job to move up to an executive, though.
Yeah, I guess.
So, if we had to create a list of every issue that you want to discuss today and why you came in to visit us, where should we start?
Well, I have high blood pressure, and the home care nurse comes time to time to look at my foot. My diabetes has been acting up. The doctors tell me I have to lose weight, and I guess I've been feeling pretty sad lately too. I don't really feel much joy in doing things I used to, like going to church. I used to be pretty active in church, going every Sunday to services, teaching Sunday school, stuff like that. I also don't sleep well anymore. I'm up all night and then I usually sleep all day. It feels like I'm always tired and cannot concentrate when I'm awake. I don't know if this feeling will ever get better.
Why do you think you might feel this way?
Not completely sure, but I don't feel like I have much energy to do anything these days.
Such as?
Well, as you see, I just got out of bed and came in. I sleep a lot. Showering and getting ready just seems like too much effort sometimes.
Okay. How often have you felt this way?
Almost every day. I have some good days.
What are you specifically doing on those good days?
I don't know. Usually my kids are around. Or if I have the energy, I go to church. But that usually doesn't happen often.
Okay. Well, at least it sounds like you got a pretty great family and close group of friends. Are they around much though?
Well, I live with my husband and my kids live close. I'm usually not up for visitors. My friends at church are great people too. I just don't see them very often. I guess I might be depressed. Or at least that's what I read on the internet. Isn't there something you can give me to make me feel better?
Well, there may be something, but let me recap just to make sure that I understand what you're saying. So, you came in today to visit because your diabetes, your peripheral vascular disease, high blood pressure, and that ulcer on your right foot has been acting up. And then you also said you're feeling pretty down. Is it correct? Is that a correct statement?
Yeah.
Ms. Jackson, how do you think these issues impact your life currently?
Well, I don't think it started when I stopped working. I had a purpose and was good at my job. When I stopped working, I had the church, but it was different. From there, all parts of my life kind of slowly got worse. I stayed in bed a lot, stopped eating healthy and cooking meals for me and my husband and family. I order a lot of food. I stopped exercising. My diabetes has slowly gotten worse over the years, and now this ulcer on my foot won't heal. I don't really have any hobbies. I just feel like the last 10 years of my life have slowly gone down the drain.
Well, that sounds tough, and thank you for sharing all of that information with me, Ms. Jackson. It must be difficult to talk about. It must seem like it'll all be very impossible to feel better and feel a sense of purpose, especially the way that you were working. But as a team, we're going to take the steps to getting you to feel better. It will not happen overnight, but together we will take steps each day to improve your overall well-being. Does that sound like a plan?
That sounds like a plan.
Okay, Ms. Jackson, I'm going to do a physical exam. This will basically entail me assessing every system of your body, asking you some questions here or there, having you perform simple tasks and tests, But you are free to ask questions at any point and express any concerns you may have.
Okay.
Okay? So first off, since we've been talking this whole time, neurologically you seem to be okay. Can you do me a favor and just stare at this pin? Okay. Okay. How many fingers?
2.
How many fingers?
1.
How many fingers?
Oh, 1.
Okay, go and smile. Stick out your tongue. Okay, I'm just going to take a look at your pupils. Look good. Okay. Now, can you do me a favor and stick both your arms out like a pizza tray and close your eyes and hold them up? Okay. Now I'm going to have you grab my hands and pull me towards you. Good, good, good. Okay, now push, 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 push. Okay, you feeling a little weak today?
This is normal.
Okay, okay. Now go ahead and kick out your left leg and hold it up, okay? Okay. What about your right leg? Okay, alright. And I see your foot. Okay, alright. Now I'm going to just take a quick little feel. Okay. Now, can you put your feet back out for me? I'm just going to feel for your peripheral vascular disease. So I'm going to feel for temperature and just kind of see how, can you feel my hands?
Yeah.
Okay. Now I have a specific tool, the monofilament. I'm just going to poke your toes and your feet. I'll have you close your eyes, and then when I touch your feet, you go ahead and say yes or no. Okay? Go ahead and close your eyes. Am I touching?
Yes.
Okay.
Yes.
Okay. Okay.
Yes.
Okay. Okay. Now let's go to the other side. Okay. Same thing.
Yes.
Okay.
Yes. Yes.
Okay. All right. Thank you. I'm just going to take a quick look at your toe or your heel where the ulcer is. Okay. Your toes are a little cold too to the touch. Can you feel me touching them right now on top?
Yeah.
Okay. Your hands cold too?
A little bit.
Okay. All right. Let me check your pulses too, okay? Okay. All right. They're a little on the weak side. Has anybody told you that before?
No.
No? Okay. What I'm going to have you do too is I'm going to have you perform the Snellen's test, which will test your eyes. And given that your hypertension and your diabetes, I just want to make sure that it has not affected your eyes too the way it's affected your feet. Okay?
Okay.
So go ahead and look straight ahead at the chart.
Okay.
We'll have you cover your right eye. And then I want you to try to read the second line of the chart.
Okay. Q C V T B M
Okay, okay.
O.
Okay, okay, that's it. Now can we switch to your left eye covered? And then go ahead and read the third line of the chart.
Oh, that's small.
Yeah.
A T S V N L
Okay,
E.
okay, that looks good. Okay, thank you very much. Do you wear glasses at home?
My eye doctor said I should wear some, but I usually don't wear them. I
Okay.
don't like the way they look on me.
Okay, well maybe we could have you fitted for contacts or maybe a flashier pair of glasses, okay? What I'm going to do is now I'm going to listen to your heart and lungs, take your blood pressure. You've had this done before, so there should be no surprises here, right?
No.
Okay, I'm just going to take a listen to your heart and lungs. Heart first. Okay. Take a listen to your lungs. Okay. Okay, I'm going to take a listen to the back of your lungs, so take a big deep breath for me, okay? Okay. 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 Okay, thank you. I've noticed that you've been breathing a little shallow and not taking very big deep breaths. Would you be interested in using this incentive spirometer? And I'm just going to see how deep you could breathe in, okay?
Okay, What do I do with
You
it?
breathe in, you put it in your mouth, and then breathe in as far as you can. I'm going to measure how big your lungs expand. Okay? Okay. Okay. Let go. All right. We'll do it one more time. Okay? All right. All right. Do you feel like you get shorter breath easily?
When I have to walk up or down my stairs, yeah.
Okay. It looks like you have your lung capacity is on the smaller end, which means you can't take big breaths very easily. So we'll have to reevaluate that. But let me just take your blood pressure too. Okay. Okay. Now I'm gonna have you do me a favor. I'm gonna have you hold my wrist right here. Hold my arm. Okay. I'm gonna take your blood pressure. All right. You feel a little pressure.
No.
Okay. Actually, I don't know what it is. Okay, very good, very good. So since you already said that you have hypertension, 180 over 100 is probably pretty normal for you. So we're just keeping an eye on it for now, and maybe we can adjust your medications if need be. Once again, I'm just gonna finish feeling your pulses. Okay, and then yeah, okay. You're still a little cold, but I'm gonna check your belly, okay, to see if you have any pain or anything. So I'm gonna have you lay flat. I'm gonna listen to your bowel sounds. Have you noticed any changes in your BMs?
No.
No? Okay. All right. Any pain when I press on it?
No.
Okay. You have good belly sounds. Okay. You must have had a big breakfast, huh?
Yeah, pancakes.
Oh, yeah.
And bacon.
Oh, yeah. Okay. All right. So now let's keep moving along here. And one last thing, since I felt your pulses and they felt a little weak to me, I'm going to actually use this Doppler and I'm going to check to see the blood flow on them, okay? Less blood flow means it's a little, it's not receiving as much, less of a sound means it's not receiving as much blood, okay? Okay. Let's check your wrists too, okay? Yeah. Okay. Okay, your pedal pulses and your tibia, your post-tibia, all those sound a little diminished, but we knew that you had the peripheral vascular disease, so we're going to just make a note of it. Okay, now what we're going to do is check your range of motion, okay? So what I'm going to have you do for me is I'm going to just passively move your arms, and you tell me if it hurts or not, okay? Okay. You don't have much flexibility. You're kind of fighting me on it a little bit, huh?
Mm-hmm.
Yeah? Okay, let's try this side. Okay. Okay. One more time, I'm going to have you lay on your back, okay? And I'm going to check the range of your legs. So I'm going to use this. I'm going to have you bend at the knee, okay? I'm going to measure your angles. Okay. Can you get up? Can you bend it a little more? No? Okay. There you go. Now let's check the other side. Okay. So you don't have much flexibility or range of motion, but you said you don't get out of bed much, so that's something that we'll also work on with, and we can put in for a referral for physical therapy as well. Okay, so what are we going to do now? Okay, so looks like your range of motion is a little less than we'd like. So maybe we should schedule a stress test as well to check out your endurance when we also have the physical therapist see you.
That sounds good. I would like to get back in shape.
Okay, yes, that would be great. Okay, you reported that you go to the bathroom more frequently these days. Do you mind if we take a urine sample as well? We just want to make sure your kidneys are working the way they should.
Okay.
Okay. Diabetes and hypertension are both the leading causes of kidney disease, so we just want to make sure everything's working in that aspect. At some point, we'll change that dressing on your foot. But for right now, I'm gonna go discuss with the doctor what we should do next, and then he'll come in and assess you. But I'm gonna take a step out. Okay?
Okay.
Okay. Knock, knock, knock.
Come in.
Okay, I'm back. Okay, Miss Jackson, we're almost done. Hang in there with me. First, I want to say thank you for coming in to visit us, and that this is you've taken the first step into getting better. Now we have determined that 3 areas in which we can make changes to improve your overall well-being. Since we are made up of a mind, spirit, and body, it is important to address each avenue.
That makes sense.
Okay. Now, in our short interview, you use some negative language about yourself. So, our first goal would be to minimize negative thinking and replace it with positive thinking. So, anytime you start to think negatively, become self-aware that you're doing it. Does that seem something like you could do?
Yeah.
Okay. So, that's the first step. Now, the next step would be to replace those negative thoughts with positive ones. So, you said you're happiest with your family and your grandkids and the church. So maybe on your cell phone or in your purse, you keep some pictures of your kids or grandkids. And anytime you have a negative thought in your head, catch yourself, choose to stop thinking about that negative influence, and then take a look at those pictures. You'll be happier, and you'll divert your brain from those negative thoughts. We'll slowly but surely try to retrain your brain. Does that sound like a plan?
Yeah.
Okay. Can you agree to putting those pictures on your cell phone or in your purse?
Well, I don't really know how to work my cell phone, but I'll put some photos in my wallet.
Okay. That sounds just as good. And we will also be referring you to a therapist or a specialist so that you can follow up with them and see if there's any other strategies that would be beneficial for you to try.
Okay.
Okay? So next, we need to reconnect you with the church, or at least your spirituality. You stated it seems like too much work to get out of bed and go to church. But what if we find a quiet place for you to pray every day? Possibly outside your house or someplace quiet where it can just be you and your thoughts. You can use this opportunity to think about all the things that you're grateful for, such as your husband and your kids and your grandkids. So once a day, let's plan to find a quiet place outside. In the fresh air and the sun will probably do you best. And we will spend a few minutes saying your favorite prayer, or at least thinking of 3 things that you are grateful for. Slowly you will increase the time, and maybe you will even find the energy to attend church on Sundays, and possibly even teach the class, but one step at a time.
Okay, I think I can try that.
Okay, that's great. Now that we have a plan for our mind and spirit, let's make sure we take care of our body too. Let's plan to eat healthier. Now, you stated that you don't have the energy to cook and that you order in a lot. Well, let's say we order in something a little healthier than pizza from our local restaurants. There are also delivery services from local grocery stores that will deliver you healthier options such as fruits and vegetables when you determine that you might have the energy to cook as well. Does that sound like something you can do?
Yeah, maybe I can start cooking some smaller meals for my husband and myself.
Absolutely, but let's just work on replacing a meal a day with a healthier option, and then we can slowly progress from there. So let's recap. We are going to minimize negative thoughts by replacing it with positive self-talk and happy images. We are going to slowly reconnect your spirituality by creating a quiet, peaceful environment at home in which that you can pray for a short period of time once a day, and we'll slowly increase the length over time. We're also going to continue to order foods, but this time healthier options, and slowly incorporate preparing our own meals. We'll take care of your mind, body, and soul, and overall you'll have a better outlook on health. Does this sound doable?
Yeah.
Okay, so we have follow-up appointments with a nutritionist, wound nurse, therapist, physical therapist, and And we're going to do some tests, follow-up tests, and we'll contact you if anything is abnormal, such as your urine test. And if there are any other questions, please do not hesitate to contact us. We are all here to help you and answer any questions you may have. If you are set to go, I can show you the way out.
Yeah, I don't think I have any more questions. Thank you for your help today. I'm actually looking forward to having goals and something to work towards.
Okay, absolutely. Remember, just one step at a time. Okay? Here, I'll show you out. You could get up.